want to start by discussing the pandemic, which is really ravaging the country and especially your state of Louisiana. It's in dire crisis, a record number of hospitalizations. ICUs are running out of beds. You are also a physician. So when you see this, what goes through your mind?
Well, we can stop it. We have it within our power to stop it. Each person that is vaccinated now protects not only herself or himself, but those around him, because no longer is she as likely to pass the infection to others. If we don't want this, we have it within our control. All we need to do is to get vaccinated.
Your state's governor, John Bel Edwards, issued a new mask mandate, put it into effect this week. Was that the right move?
Well, I'm now going to speak as a doctor. If you have a large percentage of your population which is not vaccinated and your infection rate is going up, you got one of two choices. If you're inside, either you're vaccinated or you have to wear a mask. Otherwise, you're at too great a risk to further spread infection, to further pack those emergency rooms, to further prevent people who have terrible accidents from getting cared for because the hospital is full of COVID. And there is a choice. On the other hand, if we don't want mask mandates, get vaccinated, the infection rate goes down and you don't have a mandate.
So it sounds like you're saying that's a yes, given where
As a
things are.
doctor, I will tell you, you've got two choices to stop that infection.
Okay.
Either get vaccinated or wear a mask.
Some governors, like Ron DeSantis in Florida, Greg Abbott in Texas, they're blocking local officials from imposing restrictions like mask mandates. The virus is surging to record highs in those states, including yours. So, as you said, you are a doctor, you are an elected official. Shouldn't local officials be allowed to make decisions like mask mandates if they believe that's best for their local community?
I'm a conservative. I think you govern best when you govern closest to the people being governed. And if a local community is having their ICU is full, and the people at the local schools see that they've got to make sure they stay open because otherwise children miss out for another year of school, and they put in policy, then the local official should be listened to. That is a conservative principle.
So you disagree with Governor DeSantis?
I do disagree with Governor DeSantis. The local official should have control here. I don't want top down from Washington, D.C. I don't want top down from a governor's office. Sometimes, yes, okay, national defense and such like that. But when it comes to local conditions, if my hospital's full and my vaccination rate is low and infection rate is going crazy, we should allow local officials to make those decisions best for their community.
Is he playing politics with this?
You know, I don't know if he's playing politics. I try not to guess other people's motives. I will say politicians should not kind of carte blanche accept what the public health doctor says, but they shouldn't just gratuitously ignore it either. There has to be a balance there. And whenever politicians mess with public health, usually it doesn't work out well for public health. And ultimately, it doesn't work out for the politician because public health suffers and the American people want public health.